Welcome to the effort to address the national health equity crisis we are experiencing in bleeding disorders today. I am Ashley Gregory, the Education and Advocacy Director at Hemophilia Foundation of Northern California. As most of you know, women, mild, moderate, those with von Willebrand's disease, platelet storage pool disorder, and Glanzmann's thrombocythemia suffer from lack of diagnosis, treatment, and access to medication for their disorder. Our national, regional, and local foundations have done an outstanding job of educating our community members, families, and advocates on their disorders. MASAC created treatment guidelines, and HFA created a Bleeder's Bill of Rights. Many of us are well educated in our particular bleeding disorder, and thanks to My Life, Our Future, some of us even have our genetic mutation, and we carry this information with hope of a diagnosis and treatment to our local treatment center, only to be denied access to diagnosis, treatment, and medication. Some of us decide to end our fight there. Others choose to travel further away from home to seek a diagnosis. Some to other states, which becomes problematic when filling prescriptions or seeking local treatment. Many, like myself, have endured a lifetime of untreated pain and symptoms, while we watch men and boys related to us, like my son, receive prophylaxis to protect their joints and keep them safe. Witnessing this crisis in health equity in the bleeding disorders community, men in our community have risen up to support us. I would like to introduce one of them, Ray Datoli.
Wow, I'm overwhelmed at the participation. This is great. My name is Ray Datoli. The purpose of this call today is basically to help start a grassroots effort encompassing the whole community. We don't want to leave anybody out. We want to laser focus on 3 issues that basically concern, we're focusing mostly on women right now, and that is diagnosis, access to treatment, and access to medication. That's including hemophilia A, B, von Willebrand, any bleeding disorder in our community. As a man with hemophilia, I talked to a lot of women in our community, got to know their stories, and watching them suffer. There are wives, there are daughters, there are nieces, there are mothers. And they're not getting proper care. I believe it's time for solidarity in our community, for men to be in solidarity with our counterparts, the women in this community, and stand up for them. We'd like input from the whole community. That's talking HTCs, nonprofits, manufacturers, home cares, and just to connect the community in one voice across the nation, be laser focused on those 3 issues. Hopefully we could move towards the goalpost of getting women proper care, diagnosis, treatment, and access to factor and any other medication they need.
Thank you, Ray. We have some testimonials from some community members, and I'd like to welcome Carolyn Callender to share first.
Wow, thank you so much for being here and listening to my story. I'm told to share it in 2 minutes. I'll do my best. Anyway, I have von Willebrand's disease. I lost my mother and my aunt and my uncle on my mother's side to complications and mistreatment of von Willebrand's disease. And this is a subject no one wants to talk about. So when you have von Willebrand's, as you know, I started periods at 12 years of age, and that kept me from school, being an athlete, just self-confidence. And even though my mother was diagnosed, there was never, I was never offered the diagnosis. It wasn't through till after both of my sons were diagnosed from nosebleeds, and both of my sons also have von Willebrand's disease. And then, of course, at Stanford Children's Hospital, that the link was there. Anyway, the long-term effects of hemorrhaging for every 25 days for over 45 years is beyond imaginable. And you might have 5 good days a month. And the long-term effects of anemia, they're still trying to find out. I was never treated for that, which I could have changed my life as far as being an athlete and education and school. And then I almost didn't make it through menopause. I kept being sent to gynecologists, even though I had the diagnosis of von Willebrand's. And if I would have followed their treatments, DNC, to name just, it wouldn't have been successful. And it is a simple blood test, but then what has to happen after that is something that I'm hoping today will have effect on listening to my story. I was able to reach out to a hematologist out of state to help the surgeon through my son's appendectomy. And still the treatment was through me being an advocate for him. And so we need more advocacy for everyone involved. So thank you for listening.
Thank you, Carolyn. Next is Lou.
Hi, I have hemophilia A, a platelet disorder, and Ehlers-Danlos, which if you look at hemophilia, it's mild, but because of the other two things, I bleed more like a moderate to severe. Didn't get diagnosed properly and start some treatment till I was 35. Still trying to get, proper treatment all the time. I am a nurse. I work for a hospital where the hemophilia treatment center is not in network for me. I volunteer with HFA since 1999, was part of the first founders of the original HFA program called Focus on the Feminine. Used to be chairman of Blood Sisterhood, like Ashley is now. But yeah, I have, symptoms. I have joints that need to be replaced now and everything from not being treated, GI problems, lots of problems from not proper diagnosis and treatment for years. And I'm Ray's wife.
Thank you, Lou. Next is Rocio Nunez.
Oh, hi, my name is Rocio Nunez. I work for the Latino community. Basically, my husband, he was born with a bleeding disorder. He's a factor A deficient. My daughter, she's a carrier. Basically, the knowledge that I have with my community, it's been overwhelming. When they come for foreign countries, not only a lot of them, they find out that the newborn child has hemophilia, they have no idea what it is. And the woman, a lot of testimonials about it, since they don't know they have the condition, they barely being able to be treated properly when they give birth. I'm pretty sure that a lot of us have listened to those horrifying stories that have been shared with us. My husband was told that he was gonna live only until he was 11 years old. He already was granted 3 last wishes. And we were thinking that, we were lucky to have him for this long time. Thanks God, we have a family. We've been married for almost 21 years. And my daughter, who is a carrier, she had experienced the situations of being a carrier, but also having the symptoms that I know she might be having a mild hemophilia as well, because of the long episodes of the bleedings Something embarrassing, one day she was standing in front of the class. She was presenting for the classroom. And unfortunately, she was wearing white colors. So, and that moment is when she started bleeding. The kids just started looking at her weird, and she was so embarrassed that she didn't want to go back to school. And she was like, Mom, why this keep happening? And as Caroline mentioned before, the absence of knowledge for not only knowing that it's not a gynecologist, it's a hematologist, the one we need to have. It's also on that industry with the doctors that they need to have not a little bit more knowledge about how to treat it and how to give us the diagnosis. That will help us a lot of women that, as many as I have served, that had only not been able not to receive the diagnosis, which not only changed their life when they have, when they are teenagers, but also a lot of situations where they have to lose a child because they're not being treated properly. And those are things that are really painful because this keeps happening. So that's a little recap of my life with hemophilia and with the families with bleeding disorders, not only hemophilia, also Willebrand. So I hope that this initiative can help our community in general so we can have that proper diagnosis for the women and the treatment. Because as somebody mentioned on the chat, not because the woman has been diagnosed, that means that she's receiving the treatment they're supposed to. It's a huge gap that we have to cover. So thank you for your time.
Thank you, Rocio. Our next speaker is John Martinez.
Hello, my name is John Martinez, and I live in the community here in California. I've got 2 adult sons who are severe hemophiliacs. My daughter and my wife are both mild hemophiliacs. We've battled quite a bit, a couple of years, to finally get my wife diagnosed. That was after years of her having bleeding issues and leading up to and ultimately having to have a hysterectomy, which would not have been necessary had she'd been treated properly. Since we had that knowledge, when our daughter came of age, we kind of knew what to do. We went through her gynecologist, got her diagnosed, but the treatment center would give us a diagnosis of von Willebrand's. So we asked to see the proof of where the blood test said she had a von Willebrand's deviation, and they couldn't show it to us. They said, actually, it was her low factor A levels. They said, then she's a mild hemophiliac. So after some back and forth, they finally gave us a diagnosis of mild hemophilia with von Willebrand's. But about 3 weeks ago, I took her to the doctor, to the hematologist, for a follow-up for some issues she's having. And the hematologist basically told us that she has von Willebrand's. I said, well, actually, no, she's a mild hemophiliac. He said, oh, here on the chart says von Willebrand's. And we said, no, actually, if you look at her blood test, there's nothing wrong with von Willebrand's. It's just she has low factor levels. And the doctor said, well, it's no big deal, because women don't bleed anyway. They don't really have hemophilia. And I said, I hate to disagree, but I do have several years of dealing with this. And I know a lot of women who bleed and have severe bleeding. And she kind of, well, yeah, but it's just, it's so rare that we don't talk about it. I said, well, I'd really like to talk about it because it's going to affect the treatment of my daughter. So we had a little conversation, as civil as I could, but, it's kind of hard because all the arguments we have had over the years with my wife and then just getting diagnosed for my daughter. But it was frustrating to see the hematologist tell my daughter, and if my biggest issue was my daughter's 19, so I did not have to be in the room, but she asked me to be in the room with her. If she had been alone, she would have heard that information directly from the doctor telling, don't worry about it, you have hemophilia, but you're not gonna bleed, so don't worry about it. What you're going through is not really hemophilia. And that really concerned me to all those people who are out there, those women that we work with in the community. I know Rocio, a lot of these families we work, especially in the Spanish community, that don't question the doctor. That they would hear that and just go home and then deal with their issues for the rest of their life without ever questioning it. And it scares me how many women, and I think even men too, that have gone through their lives with a misdiagnosis just because they didn't have that support or that maybe that support behind them to ask questions when they're sitting with that doctor. So that's why when Ashley asked me to be part of this, I was glad to be a part of it. I'm very happy that they're doing this, and I'm glad to help in any way I can.
Thank you, John. Our last speaker will be Ray Tolley.
Look around who's on the Zoom call. We're a very powerful community. we fought HIV. We had legislation. We went up against pharma. We basically got Harvoni passed for hepatitis. We went up against companies to get new therapies in our community. We fought for equity in our community. We have the talent at the grassroots level that can support our national organizations. We will get support from certain HTCs, pharma, specialty pharmacy. We're all in this community together. And there has to be a grassroots cry pushing the whole thing. I support NHF's endeavor. I support wholeheartedly HFA's endeavor on this. I want to know, how can our grassroots voices, how can we yell loud enough that they will, not HFA and NHF, that the powers that be will hear us and basically have to do something, have to recognize that there is a big gap and women need to be treated. And as men in this community, a lot of us feel like we've been sidelined, and we do have a horse in this race. Watching my wife suffer, I'm third generation hemophiliac. My mother had 4 sisters. Most of them had really little problems, or they must have been undiagnosed. But as a hemophiliac man, to sit there and watch women, my wife and other women I know in the community, not get care is appalling. It does not compute with me. Women are viable. They are actually, if you think about it, they are the first thing a hemophiliac son sees as an advocate. That's the strongest, most of the time, it's the strongest person in our life is our mom. And they're standing up, they're fighting for us, they're arguing with doctors, but yet that doesn't happen when women go to treatment centers. Whether the doctor's not listening, whether he's not, I mean, we have the data. We know this. Well, let's just scream louder like we did for HIV and AIDS and let them hear us. Thank you. And thank you all for being on the call.
Thank you, Ray. All of those stories were so compelling. I hear them every day as the director of our advocacy department, and something that we came up with, which we hope will be effective, is a national effort for the HTCs to sign on to the wonderful guidelines that were developed by MASAC and the Bleeders Bill of Rights, which was developed by HFA. And we'd love to open up this for discussion now. Input, ideas, feedback, everything. And it's being recorded, so just your thoughts will be heard.
I'd like to say something, but I'm not sure I'm being heard.
We can hear you.
We can hear you, Priscilla.
Oh, yeah. I guess most of you know who I am. And, you know, yet I did everything I could for my son until he got AIDS. And I'm very fortunate that he's still here. I'm 73 years old, and I'm tired of fighting. I'm tired of fighting to get help. I'm just tired of it. I don't have much energy left to keep it up. And I hurt all the time. Tell them, Red, how much pain I'm in.
She's in pain constantly. She's lucky if she can walk from here to the mailbox.
And they don't believe me. I'm the only female with factor VIII at our hemophilia treatment center. And they don't know how to treat me. I've sent them contact information for other doctors they can call, but they don't do that. They think I'm a hypochondriac. I can't make up these bleeds. I take pictures of them, I show them to them. They will give me home treatment, but then they act like I'm just making this up. It's almost like they don't even want me here as a patient. And I don't know where to go, because now my husband and I are both too disabled to go to any other places. I had been treated in Penn with Dr. Barbara Kunkel early on. I went through all of this, the same thing, you know, the unnecessary hysterectomy, the nosebleeds, the joint bleeds, the ankle that keeps swelling that they won't treat. I have been told basically that no one wants to treat me. I don't know why they are so afraid to help me, and I don't know what to do. That's why Ray, you know me, many of you know me. I have been an advocate, but to tell you the truth, I'm tired. I'm just tired and I want to give up. And I'm sure I'm not the only person on this call who has seen or felt that way at times. So thank you for listening to me.
I think what's really sad about her case is if she was a pediatric patient, she would get great care at that hospital, because my daughter goes to that hospital as a pediatric and gets great care. So it's really heartbreaking to hear these stories that a child may get care, but an adult doesn't get care in the same facility because they see different doctors. The pediatric patients see a pediatric doctor, the adult patients see an adult doctor. The whole system is messed up, and it's really heartbreaking. And I know there are people on here from NHF, HFA. This is Chris Timblin, by the way, speaking, if anybody doesn't recognize the voice. But it is very heartbreaking to hear this. This is, and I want to strangle the next person that says things are getting better, because, yeah, okay, things are getting better. Great, they're getting better. But they should already be better. So I don't want to hear they're getting better, things are getting better. This is just ridiculous. The HTC system is a mess, and something needs to change. And it breaks my heart to hear Lou and all these other folks. You know, John, your story, Carolyn, your story, Priscilla, your story. It just breaks my heart, and something needs to change. And like you said, Ray, it's about time the men put their big boy pants on and help the young ladies, because, you know, it's only a matter of time till little Stevie or little Johnny has a daughter. And oh, by the way, now your daughter has hemophilia, so I'll shut up. Sorry to take your time, Ashley.
Well, we're also told constantly that because our levels are higher, that they're afraid we're going to blow or throw a blood clot. I get so sick of hearing it. There's 1 million people walking around with levels over 100 every single day, you know, that aren't throwing blood clots. And, you know, you go to one HTC out of desperation, and you get what you need. And then you go to the one in your state because now this HTC can't write a prescription for out of state. And then you're told, no, you know, your levels are too high. You shouldn't be, you shouldn't be, you shouldn't be, you shouldn't be. And you've got proof, you know, and you fly across the country to find out you have EDS that's causing more bleeding. You fly across the country to get all these answers when you've got some of the best hospitals in your state, and you're told it's the placebo effect. You're crazy. You know, my thyroid levels are fairly normal, but because I have a family history, my doctor treats my thyroid because I have symptoms. I have a family history. You know, my son, who is also mild, can be in the room next door to me and get prophy all day long. And I'm told I will never write you a prophy script ever from this office. You know, and it's frustrating. It's, I have to see a private hematologist to get what I need. And that's okay. Except just like my son, I deserve comprehensive care. My joints, my muscles, my body is just as important as every man, every severe. They don't want a severe to ever have a bleed, ever. You know, or if you have one, we're going to put you on prophy. But it's okay for me to have 100 in my lifetime, or who knows how many. You know, it's okay to force me to have a hysterectomy at 33 because you've never bothered to check and see what's wrong with me. You know, it's okay to put me on Lupron injections that's for male prostate cancer when I'm 21 because I'm bleeding so bad. That's okay. It's not okay. And I could go on and I won't do that, but I just get so worked up and so mad and so frustrated. And this is going to sound vulgar, but I'm going to say it. There's days I think, I wonder if I just pretend to have a penis or something and, you know, pretend I'm a man and go in there? Would I get treatment then? It would be a great, you know, study to see if we all, you know, give them our records as a male and not a female and see what they say. It's sad and it's frustrating. And I put in the comments, and I'll, you know, just say it real quick, that they do claim they treat women. They all claim it. And we have this excellence of care. Who's looking at that and saying, no, you're not an excellent facility? Nobody. They have a checklist. They check off, yes, we do this, yes, we do this, yes, we do this. They don't do that, but they're still on this website as a center of excellent care for women. It's bull crap. It's not true. And if you have a period, yes, you may get a little bit of care. If you have something major happen, you may, but our day-to-day lives are affected. Every day I wake up in pain. Every day I have a joint that hurts, you know, and when you're told, here's some factor, but you have to call to get permission to use it first. No, you know, you trusted me with my son his whole life, but you don't trust me to look at myself and know if I have a bleed. It's frustrating. And I'm so happy to be here, and I'm so happy you all are here, and I am happy to see where we can go and what we can do, but we're going to have to fight hard. And I think if we could get other HTCs and doctors behind us, that's going to be part of the solution. But there's still people who just, doctors that refuse to treat us. And I don't know the answer, but thank you for doing this.
I want to add, I'm sorry. I want to add something. As you mentioned, when we are having the educational programs for the families, what is the number one thing we always say? You know when something is wrong with your body. You know better than anybody. But after that, after the talks, after the nurses, the doctors tell us the symptoms and how to recognize them. When we as women see that happening in our own body, as you mentioned, then what? Is the step that we haven't reached yet. And I believe that it's a lot of doctors as well that serve the community, that they well aware and they want to help, but unfortunately, sometimes the ties that they may have with the companies they work for doesn't allow them. So it will be a dream maybe, but I believe because a dream we are here together today. We want to do something, maybe create a group of doctors, hematologists that are willing to work for this group and together elaborate something as a guidelines of how to diagnose the woman with a bleeding disorder named hemophilia, Willebrand, so many others. And then also advocating with the companies to include, not only to include the women's as the caregivers, but as the person to study them. Run trials in women is needed. I mean, how else are we going to change it? That I believe that part of the industry, they understand us. A lot of places that we go and they hear the stories because they know us. They're familiar with our families. You know, they know who we are, and they said, "Oh my God, I heard that firsthand." They said, "Oh my God, I wish I can help you. I wish it's something that I can do." Well, maybe something that they can do is talk to their bosses and say, "Listen, the women are asking to be included on the trials. Why don't you do it? Start by the little big steps. We'll go down because that's the only way we're gonna be included." Yes, because if the woman is having the pain and is having the bleed and is unable to work or to do the duties as a mother, and the kid has has a bleeding, who is taking care of them? Mostly is us, the women. And when the woman cannot do anything, the house is upside down. And I admire a lot of men who can do a lot of things at home, but let's just face it, it's not all of them. It's not all of them. And it's mostly the mother who is taking the kids to the treatment centers. Now they're taking the kids to the treatment centers, but they're not being taken care of. And as Stormy mentioned before, you go and they said, we have an excellent providing service to women, but there's no inclusion of, if only the pediatrics department is the one who's doing that work, well, maybe, might be stupid, but maybe grab some pediatrics, you know, hematologists and guide us. Just a comment.
Ashley, I wanted to say something too. I hope you guys are seeing me. Thank you for everyone who's been sharing. I just in listening to everyone, and of course in the listening we've been doing for multiple years now, just in the community. I think what's hard is that we have, it's peeling an onion, and we have layers and layers of issues here as I listen to everyone. So we have issues about women getting treatment when they show up at centers, diagnosis and treatment. We have issues, as were just mentioned, women want to be included in research, and that's probably more of conversations with pharmaceutical companies who are developing medications, and how do we work with them to be included in trials. I think women for a very long time have been asking, I would even say begging, to be included in trials so that there's actual data. We know NHF is really trying to work with their state of the science on creating research efforts so that data is gathered. But of course, the frustrating thing with research is it takes a lot of time, and we have people on the ground now, so there has to be a balance there, but we do still need that research. One of the things that hasn't been mentioned yet that I remain incredibly concerned about, and I know that this has come up in multiple circles that I've been in discussions, is early testing, so that if we know that there is a male who is affected in a family, that there is some sort of standardization of the timing of when all the women in the family would be tested, including young girls. So we know that when a young boy is born, particularly with hemophilia, but other bleeding disorders as well, they're tested pretty soon, you know, depending on whether it's hemophilia A versus B, but definitely within the first year of life, usually much sooner. And baby girls aren't necessarily given that same testing, and some are given the message that it's okay to wait, maybe even wait as long as before their first period. And that is of concern to me, because even if the statistics are 1 in 3 girls may have low factor levels, to me, I feel like that needs to be discovered before a girl is in a car accident at age 2 and needs significant treatment. So I guess my question might be, because there are so many layers, you know, how as a group might we pick, how might we focus in a way to, you know, maybe we won't be able to address everything, but is there something that could be addressed, and could we start with one of the many layers? So, and for me personally, I'm very, very worried that young girls and infants are not on a radar when they should be.
So that's why we basically came together, and we want a grassroots effort. We want to be laser focused. We understand it is an onion. You're going to have to be peeling everything back. But I've talked to some hematologists, adult clinic, and I just talked to my treatment center today, and they will buy in. So it's the action steps. What can a grassroots effort in this community? Because like I said before, we have a lot of talent. We've overcome a lot of stuff in hemophilia and in bleeding disorders. How can a nationwide community focus on the 3 issues that we outlined in the beginning? And they will grow. Those issues will grow. It's not just confined to it, but in the beginning, how can a grassroots effort, all our voices across the country, be put into action so that we can support our national organizations in their endeavors? I'd like to hear some suggestions. Maybe it's stories, maybe it's through government legislation. We have talent in that area too. We're not we're not a community that's short on resources. We have a lot of it. Let's just get it all focused and headed into the same direction.
Right, that's one other
Templin
piece.
has his hand raised. Sorry, Chris Templin has his hand raised, and then Rich, you can go next.
Okay.
Thank you.
Yeah, I wanted to piggyback to what you were saying, Shirley. I think it is important that some sort of testing mechanism be put into place. I wanted my daughter tested the moment she was born, and the treatment center I go to said, "We ain't doing no fishing expedition. Bring her in if she has a problem. If not, we'll see her when she hits puberty." Luckily, she was born at a different treatment center, and she did get tested the moment she popped out of the womb. And, she has 12.5% factor 9. And I'm glad I know that, because we were in a couple car accidents and she was in the car seats. So there needs to be a focus on testing. There needs to be a focus on prescribing the medication. There needs to be a focus on the bleed patterns. Some people may have a mutation, such as some of the folks on the call. Their levels are higher, but they bleed. There needs to sort of be this all-encompassed approach. And it's not rocket science. We can send people to space, if you got $50 million or whatever it costs. It's a test. It's a blood test. The centers are equipped. The system is there. The product can be prescribed by any doctor that can write a script, can write the script for clotting factor. Doesn't have to be a hematologist. Can be your gynecologist, your PCP, your dentist, et cetera, et cetera. Hell, my veterinarian could even write me some factor if I need it. But at the end of the day, it's not rocket science. I think there's a good group of folks here on this call that can effectively make change. And we're not asking for anything that's out of the ordinary. The system is here. Let's put it to use. I'm tired of complaining. I'm tired of feeling guilty because my daughter stubs her toe or has a bleed. She's getting factor. I have it right here available, bing, bam, boom. And it sounds like a lot of you females on the call have to jump through hoops, join the circus, and run away to the neighboring town to get product. And then even if you get product, you have to call the doctor like you're some little peon peasant who doesn't know what they're doing and doesn't know how to infuse. And it's ridiculous. Like Stormy said, they trust you with your child, but they don't trust you with yourself. It's really sad. I'm here to help. Whatever you need, give me a call 24/7. Thank you.
Rich, you're next.
Oh, I was just going to say another piece of this puzzle is the insurers. I think a lot of insurers are not going to pay for this kind of testing or clotting factor until they get educated on it. And I think that is part of the problem.
To be honest, I've never had, I've been on Profi, I think 3 years now, been diagnosed around 7, I don't know, 3 or 4 years. I've never had the insurance company reject my factor at all. It's always the doctors who I'm fighting against. Not to say that they won't. Now, I do know that, if you go looking at long acting, this or that or whatever, there's more criteria for milds and things like that. But again, if we could get the diagnosis and get the treatment, we can fight the insurance companies, but we can't fight the insurance companies when we don't even have a prescription to fight them with.
Carolyn, you had your hand raised. We can't hear you, Carolyn.
Can you hear me okay? No. I'm gonna go up. Can you hear me now?
No.
No.
We can
Why
hear
don't we
you,
let
but
someone else?
far.
Oh, there you are.
Can you hear me?
No.
Okay, Carolyn, we've got some audio problems. Can you see if you can fix that, and then somebody else can go? There were some really good comments in the chat. Oh, I see Kendall has her hand raised. Go ahead.
So I shared the, let me lower my hand before I forget. So I shared, there was a CDC fact sheet that goes to HTCs Women are not mentioned at all. If you pull it up, you can see that, which is a problem to me. And, you know, I know we do a lot of stuff among ourselves, but how about Athens, where all the HTCs, they all meet? I think that's the pinpoint where we should be and representing as a group at those meetings. I don't know if anyone's ever done that or thought about that, but that would get right to the HTC's attention.
Can I say something or is somebody else on?
Go
Ray?
ahead, please.
Ray, how did we ever get the movement started with the HIV/AIDS? How did we do that? Because, you know, we couldn't even tell anybody for years. And that was in the early 80s, and we didn't get a movement going till the 90s. Our Washington days were in the early 90s. How did we accomplish that when we couldn't even talk to each other? How did we do it?
Critical mass, and I don't want to offend anybody. We got pissed off. We got tired of not getting care. We got tired of not getting listened to. We realized we needed allies. We went to the LGBT community. They came to us. We basically started to raise our voices as one community. Everybody, gay men, hemophiliacs, whoever was infected basically with HIV, we all got into a group and we started to basically let them hear our voices and say, we're not going to stand for this anymore. There has to be something done. It was a crisis. This is a crisis in women and bleeding disorders. And I, for one, don't want to stand around and just watch women suffer and not get care. I have a daughter. I have stepdaughters. Many men in the community have daughters. This is not, and I understand it is a huge onion. There are many ways to attack it. But if we stay focused and get the community as one voice with a target issue, the others will fall into place. The insurance will fall into place. The testing will fall into place. But we need to get their attention and say, this is a problem. Let's look at this, the issue, diagnosis, access to care, access to factor. Then we'll figure out the insurance end of it and fight them. What pharma wants to fight, what specialty wants to fight. We'll fight all of that. We'll fight for equity in all bleeding disorders. But we have to start somewhere, and we have to start moving with one voice in the same direction. And I don't care where that comes from. It could come from NHF. It could come from pharma. It could come from HTCs. How do we move that ball forward towards the goal line of getting women in the center, them hearing us? Because that's exactly what we did with the AIDS crisis. And we did that. That's exactly what we did with hepatitis. That's exactly what we did. And that's what this community does best. This community was grounded, founded, and worked. Especially my family started in the 50s with hemophilia with NHF. This community started on advocacy and standing up and saying, we deserve better care. We're a model for every other disease state to basically come along and follow. We are the poster child for how do you want to advocate and get what you want? Look at hemophilia. We've done it. We have the talent. I mean, just look at the chat. Everybody's coming up with all these studies and everything, websites, and it's great. But we need to be focused on one laser issue. Once we have that issue, we could ask for the world. But we need to get that issue down as one community from California to Maine to Florida to Washington State to the whole Midwest and say, we're not going to stand for subpar care in women with bleeding disorders anymore. And then hopefully we get movement and more action steps.
Thank you, Ray. Carolyn?
Yeah, I just like to piggyback what everyone said. And hematologists, from a women's point of view, hematologists and gynecologists really need to work together. And then when in childbirth, it won't be the fifth cause of postpartum death in women, but not only in childbirth, the women will be treated and the child, whether it's a daughter or a son. And my sons, we all went through horrors because of not being tested early. And that should just be a common question on it's 50% hereditary for von Willebrand's disease. And then the long-term effects of anemia, can cause death. it causes depression. My mother tried to commit suicide when I was 12. And then again, later on, because you just, and to piggyback also what someone said, to be your own advocate when you're trying to raise a child, you're depleted and you're taking care of your children first. That's what we do. And you can, when I was going through menopause, I ended up losing almost half my blood. And then I was admitted to the hospital and then still didn't have the right treatment. And so the long-term effects of anemia can be so easily preventable. It's such an easy fix for any bleeding disorder. So just again, starting with early testing for hematologists to work with gynecologists, they keep sending women to gynecologists who some of their treatments will cause death.
Thank you, Carolyn. Rocio, I saw your hand up and then it went away. Did you want to talk? And if there's one last person after Rocio, we do want to end on time and out of respect of everyone's time. And we thank you for being here.
Well, basically, we were saying that we were gonna start trying some ideas, things that they might work or not. So we have talked about so many different things that we want to happen, but by knowledge, I know that a lot has to be, when something happens, is because the media is aware, is make it public. One of the first things, what we were talking the other day with the legislations, Ashley, when I talk about with the legislators about the needs for the women to be receiving the diagnosis and the treatment, and most of them were women on the legislation days. So they were very understanding of the needs. So maybe one of the first things that we should do is introduce a bill that will cover the women. So that way they can take care of something that somebody mentioned about insurance, because while it's covered in some states and with some insurance, not all the insurers do the same on different states. So I was thinking on that, that a bill has to be introduced, and then we get in contact. You know, the HCC did an amazing job on the legislation days these past few years, and I'm pretty sure they can support us. And then go to the media, and then start making march, then start asking to our community, writing letters, stories, pictures, anecdotes. I mean, telling the stories of what happened in the families. Picture something that they can, as you mentioned, as somebody mentioned before, we need to put the face of the need. La cara de la necesidad. We have to put it right there. And it's a lot of women who may not be able to participate because of the time. It's time for them to work or to do different things, but mostly working. So that's my suggestion. Thank you.
Thank you. Did anybody else want to say one last thing? We're at time, and I understand if people want to go. I will be scheduling a follow-up meeting for this in 2 weeks.
I have one thing. This is the, has there been any communication already with the Foundation for Women and Girls with Bleeding Disorders about this topic?
No, only because we scrambled to put this together. So we will definitely invite them. Absolutely.
Yeah, I mean, I just saw in the chat that someone mentioned, let's, you know, I think there is a movement going on. I don't want to dismiss what's going on here. They are a very strong organization, and that if we can partner without tripping over ourselves, I think that would be great.
Can I say something as a senior citizen here? Please, please get this done for me before I'm not here anymore. I want the next generation to not suffer the way we have. So please get this going. And thank you all for caring enough to be here. Thank you.
Thank you so much, Priscilla, and everybody. You'll all be receiving another invite. I want to thank everyone for your incredible input. We're recording the chat and this meeting, and so signing off. Thank you.
Thanks.
Thank you, everybody.